Hello guys. Hello guys, welcome back. This is Judith Basilo Keke taking you on Unit 3 of this course, the Developmental Abnormalities of the Mouth. Please like, comment, subscribe to my YouTube channel. It'll help me a lot to do more videos. And if you have any questions, just comment and I will respond. Okay? Um, let's let's get into it. So, welcome again. Today, we are going to learn about some conditions that develop while the baby is still growing in the womb. These are not infections or injuries, but they are rather developmental abnormalities, meaning something didn't form the right way. Okay. Um, I want to show you something. So stay with me. My network is a bit poor today, so but I'm just going to delve right into it. So now we're going to be looking at macrognathia and micrognathia. I know this word sounds big and scary, but they are easy to understand. Macrognathia, micrognathia. So the macro has to do with large jaw, and the micro has to do with small jaw. Okay? Macro has to do with small jaw, and macro has to do with macro large jaw, macro large jaw, micro small jaw, please. Sorry about that. I want to. Okay, so I'm trying to get an image. Sorry, I'm supposed to do that before now. So, but you can check to download these images yourself. But let me show you. Let me quickly show you something. The micrognathia. That's the small jaw. Okay, stay with me. Let me share my screen. So looking at the screen, you're going to see this baby with micrognathia. Micrognathia, that's the small jaw. Okay, micro, so now you understand what it is. So the one with macro will have to do with big jaw. So you have an idea of what this is. So I want to show you this. This is cleft lip palate. Some of us know this already. Okay. So without wasting much of our time, these videos are short. I want to make these videos as short as possible so that we can look at. So on your own, you can go and take pictures. You can go and take pictures or go on Google and search these things by yourself. Okay, that'll be all. So going forward, so we are back here. We are back to the developmental abnormalities of the mouth. A quick one, as I'm about to explain a little bit more, then we forget about it and we move to the next topic. Sorry. So this can actually affect how a person bites. When we talk about the large jaw and the small jaw, now you know what these jaws are being called. So this can affect how a person bites, chews, or even speak. I think you might have experienced or seen people like this. You might see it in patients with certain syndromes or birth conditions. Okay, so number two, which is the cleft eye, or the number three, which is the cleft lip and cleft palate. A cleft means a gap I showed you in that baby's picture. This happens when the upper lips or the roof of the mouth, that's the palate, doesn't close properly during fetal development. So the cleft lip is a split in the upper lip. The cleft palate is a gap in the roof of the mouth. Please take note and go through this, okay? This can cause feeding difficulties in babies, speech problems, and require surgery to correct. These surgeries come out successful as well. So when you go to Google, you can see the before and after of these cleft palates, before and after. Just like I showed us in the image, there are surgeries that have happened. Um, we have the amelogenesis imperfecta, amelogenesis imperfecta. I'm trying. I might not be good with teaching pronunciation, but I'm just trying. Okay. I just want you. I don't want you to get scared about the pronunciation. I just want you to flow along. Amelogenesis imperfecta. So amelo is enamel. It means enamel. Genesis is formation. Then the imperfecta is the imperfect. So it means defective enamel formation. Okay? Say amelogenesis imperfecta. Okay. So these patients have teeth that look discolored or weak. Okay? Discolored or weak. Uh, Let me show you an image. Let me share with you. Show you an image. So we have here, see this? This is an example. Okay. We're going to be doing before and after cleft palate. So you see this amazing pictures. These, you see, it doesn't even show. Okay, it doesn't even show. There's another one I like to show us. You see what's going on here? So there's another one I like to show, which is the dentinogenesis imperfecta. Dentinogenesis imperfecta, same idea as uh, amelogenesis imperfecta. But this time around, it is the dentin that's defective. Okay, so the word dentino is dentin, genesis imperfecta, faulty formation. So teeth may appear blue, gray, or amber and are prone to breaking. Let us check it out here to see for ourselves. Look at it. 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 Look at this is look at it. Look at it. Look at it. Look at it. Okay? So um we have the dental fluorosis. Are you with me? Oh, sorry, I'm trying to get an image for that. So dental, we have the dental fluorosis. Dental fluorosis. I want to show you dental fluorosis. Hold on. So dental fluorosis is caused by too much fluoride intake during tooth development. So it doesn't mean the patient is sick, but the enamel may appear molted, chalky, or brownish. Okay. So so this is commonly in areas with naturally high fluoride in water. Okay. You see? So look at this. It is showing you normal, mild, moderate, severe. See? See, some of us might see these things in people's teeth and we don't know what it means. We don't know what it means. Okay? So let me quickly go back to our material. So that's it. Um yeah. So we said that dental fluorosis is caused by too much fluoride intake during tooth development. It doesn't mean the patient is sick, but the enamel may appear molted, chalky, or brownish. Okay. So I have a question. So we've come to an end of this class, and I have few review questions for you, which is, what is the difference between cleft lip and cleft palate? And describe what amelogenesis imperfecta looks like. Mhm. So well done, guys. Thank you for watching. These conditions are important to recognize as dental technicians. So we may be working with prosthetics or restoration of these cases. Next, we are diving into invisible world, the microorganism that lives in the mouth. Okay, bye. See you later. Please like, comment, and share this video. Bye.